Hey, this is Greg McKettrick. I'm the Men's Health Clinical Liaison for Revelation Pharma, and this is a presentation on alternative and non-pharmacological options for erectile dysfunction. These are our disclaimer statements for you to peruse. And this presentation, we're going to talk about not the prescription types of treatments for erectile dysfunction, but some lifestyle modifications in terms of healthy weight and diet, substance and medication avoidance, some of the herbal options, mechanical devices, and then regenerative and surgical options for ED. So ED being extremely common, over 300 million men worldwide, and growing. So it's a very common ailment. And one thing that we've talked about a lot is the fact that ED is kind of one of those diseases, like it's a big signaling disease in terms of a warning for heart disease. Call it the canary in the coal mine. Risk factors with erectile dysfunction are many. Age being, of course, one of the big ones. It used to be we talked about the prevalence of ED, and it was really focused on 50 plus, but more recently we're seeing these numbers shift to much younger populations. So whereas we used to say you might have 30 or 40% by the age of 50, now we're talking about 20% in the 20s, 30% in the 30s, and so on. So we're seeing much younger men having issues with erectile dysfunction. And this is related to a lot of the lifestyle diseases, or what's the overall health of the patient. So diabetes, heart disease, high blood pressure, high cholesterol. Obesity is a huge one, and we know that this is a big factor in both ED and hypogonadism. And then substances like smoking, alcohol, or misuse of drugs or medication, and a sedentary lifestyle. These are all big factors in contributing to erectile dysfunction. So, what do we do as far as ED treatments? And we know that there's a huge market, billions of dollars in ED medications. Probably the most well-known are the PDE5 inhibitors. So Viagra, Cialis, Levitras, and anymore, you basically can go on your computer, answer a couple of questions, and the stuff shows up at your house. So very easy to access, very easy to come by. A little bit more in depth, getting into things like the penile injections, which of course they've been around for decades, and for a lot of men, this is one of the real cornerstones in terms of their sexual function. Not always the most popular, but they work. So we've got the tablets, we've got the injections, certainly a lot of compounded medications that we use, which are combinations of these things. But what about patients who don't want to use pharmaceuticals, or it's contraindicated for them, or they can't tolerate it? What are they supposed to do? So let's talk in terms of addressing the overall health of the patient, and then some things that are on this side of the prescription world. So what feeds into these issues? As I mentioned, sedentary lifestyle is huge, obesity is huge, and then the typical diet, very, very low in healthy greens and vegetables, a lot of processed food, saturated fats, and then other lifestyle choices, alcohol and smoking. And these all lead to these metabolic processes in the body. So you get this low-grade inflammation that affects our systems. It affects the endothelial tissue function, leads to low testosterone, which kind of causes that negative feedback loop: low testosterone, low energy, boom, boom, boom. And as an end result, you get decreased nitric oxide bioavailability or nitric oxide production in the system, which, it's bad enough that it's an age-related function, but now also due to lifestyle. And all these things, of course, lead to erectile dysfunction in our patients. Oh, besides lifestyle, let's talk about some of the things that we build up to. So vascular diseases, um, we said hypertension and atherosclerosis, so anything that's affecting the amount of blood and the ability to get blood to the penis. Neurologic conditions, these can really affect the nerve impulses and signals from the brain to the penis, which really control the initiation of the erectile cascade. And then hormonal balances, again, like we said, much higher rates of obesity, much higher rates of low T at much younger ages. So, hormone imbalances certainly play a role. And then, we've talked about what the conditions are. Let's talk about, what happens when we start treating the conditions that come along with all this. So, antihypertensive medications and antidepressants, certainly any opiates or benzos, even heartburn medication because it affects nitric oxide. These are just a few of the types of medicines that can really contribute and cause issues for men with erectile dysfunction. And then again, these lifestyle diseases and the chronic illnesses, so diabetes, which goes so hand in hand with the obesity and the dietary issues and the sedentary lifestyle, cardiovascular issues, Parkinson's and MS certainly. And then more from the physical anatomy side, the Peyronie's disease, which we've discussed in the past, generally due to penile injury, but that curvature and the fibrotic tissue, the scar tissue, which at that point makes intercourse very difficult and very possibly actually painful. So away from the physical, getting into more physiological, we mentioned it. So misuse of drugs and alcohol, especially you get the opiates or illicit drugs, can be very, very detrimental. The blood vessel injuries, atherosclerosis, and hyperlipidemia, and then any injuries that could be contributed to that. Diabetes, heart disease, we've talked about that with the lifestyle diseases, obesity, of course, hormone levels, neurologic injuries or neurologic issues or diseases, pelvic or spinal cord injuries. So again, getting into can be nerve, can be physical, but this falls into any even like prostatectomies that would qualify as a pelvic surgery. And then in that same realm, radiation, anything that irradiates the nerve bed or the pelvic area, and a lot of the medications that are used to treat some of these conditions again. So what can we do? Lifestyle modification, diet, weight reduction, exercise, quit smoking, avoiding the substances, and then possibly sex therapy in terms of modifying. We've shown, actually, there was an Italian study that it was small. It was only 110 patients, but they had two groups. One group was the actual study group, where they were on a reduced diet and increased exercise routine, versus a group that was dieting but sedentary. And the group that was exercising and dieting, 31% of that population saw a resolution or improvement in their erectile dysfunction, whereas only 5% of the sedentary group did. So obviously this combination of weight and exercise, getting blood flow, is extremely important. Supplements. We see a lot of patients that report, and they're coming in with mild issues. They don't have real severe or pronounced erectile dysfunction, and for a lot of them, they're trying to avoid the pharmacological approach. They want to be more natural. So, supplements and diet. Obviously encourage the good healthy diet with the greens, supplements that are going to boost healthy blood flow. So, there's a lot of benefits in terms of approaching patients in that direction. And prior to Viagra, there really wasn't all that much out there that was used for treatment of ED. So it was herbs, it was supplements. And that's really what we had to go to. And the supplements that were used commonly, ironically enough, a lot of them mimicked the effects of medications that we currently use for ED. So here you can see in terms of the herbs and supplements, a lot of these have similar effects to the PDE5s, whether that's, vasodilation, increased blood flow. In some cases, like yohimbine, you actually get increased blood flow and increase in nerve impulses. So it's both for erectile dysfunction as well as sexual response. And yeah, we used to dispense a lot of yohimbine by prescription for ED patients. It kind of fell out of favor due to some side effects, but it's still available. You can go on Amazon and buy it. Ashwagandha is another one, great for libido and sexual function. Horny goat weed, again, akin to the PDE5s in its overall effect. Tribulus for boosting the hormone levels, and stinging nettle increase the testosterone, free testosterone in the system. And then your basics like vitamin D, vitamin C, vitamin E, vitamin B, for really maintaining and supporting healthy erectile function. And my favorite is nitric oxide. As always, nitric oxide is an essential gas that is very, very closely tied to vascular health, cardiac function, sexual function, immune system, cognitive function, overall circulatory system, any neuropathies, just so many different things. But with erectile dysfunction, it is a signaling molecule that activates the cyclic GMP so that we can actually get the proper erectile response. And like so many things, nitric oxide production really decreases with age. So by 50, actually by 40 even. By 40, you're down to about 50%, and by 60, you're down to 15%. And that's actually probably a little bit on the light side, simply because we know with changing diets, people just don't eat in a way that supports healthy nitric oxide production in the system. So, why do we need this? Well, it's our natural vasodilator in our body. Obviously, it really is tied and true to so many of our circulatory functions. But without it, the medications like the PDE5 inhibitors, which, they're there to prolong the effect of that cyclic GMP, but without sufficient nitric oxide, you're kind of looking at 2 legs instead of 3 on your stool. It's going to not operate too well. And there are different types of supplements on the market. There are the amino acid nitric oxide supplements like L-arginine and citrulline. I prefer the dietary nitrates, which they really focus using a lot of times potassium nitrate, spinach, beets, arugula. It doesn't have to be, the system doesn't have to convert it through the nitric oxide synthase pathway. So is more readily available. It's more age appropriate for our patients, simply because the amino acids they have to go through nitric oxide synthase, and that pathway, just like our natural nitric oxide production breaks down, well, so does that pathway. So here we've got these 45, 50, 55-year-olds taking the L-arginine products, and they're really not efficiently converted into systemic nitric oxide. Whereas the dietary nitrates, they can be used by anyone of any age, and they're effective. So that's really why I prefer them. Staying on the OTC side of things, there's a new topical called Eroxon that is on the market. And the advertising for this I love because it's FDA cleared for treatment of erectile dysfunction. So, what does FDA cleared mean actually? Well, it actually means that the manufacturer demonstrated that this particular product is pretty much the same as some other product that's legal on the market. Doesn't mean they tested it, doesn't mean they ever even held it in their hand, but they can list it as FDA cleared. Essentially, what you have here is an alcohol compound, and it's applied to the penis. And what happens is, as that uh, alcohol starts to change some temperature there on the body, um, it's starting to evaporate. That's inducing blood flow. In European trials, they had some great study numbers that showed that this was actually almost as effective as Viagra, like 61% effective rate. Unfortunately, in actual patient use and testing in the States, what we've seen are rates that range between about 0 and 25% effectiveness. So, really, not much more than a placebo. It's the cooling effect, temperature effect. It can only do so much. So, what's been around for a long, long time? How about vacuum erection devices or penis pumps or VEDs? Um, they were introduced originally back in 1874, and then uh, that's the first it was actually applied for the treatment of ED. Then they added the addition of not just the vacuum suction but the compression so that you could maintain the erection, and that was 1917, Dr. Lederer. And that pretty much went unchanged for, over 50 years. And then at that point, what happened was uh, more scrutiny came down on the vacuum pumps, and there were some language that came against them, causing some disturbances in the supplies. And they were called a pornographic device, and they were brought under question for their safety and efficacy. So little turbulence, but by 1982, the FDA actually had stepped in, and they labeled it as a viable product for prescription use for the treatment of erectile dysfunction. And certainly was maintained as one of the most common treatments through the 1990s. VEDs are extensively used in prostate cancer patients, post-prostatectomy patients for rehabilitation. Um, the main reason is to restore good, healthy blood flow and restore the health of the tissue, because it's known that there can be a period of up to 3 years post-radical prostatectomy where the nerve beds remain stunned, and it prevents natural erectile function. And what you can do by actually using that vacuum pump, not only does it help to stimulate the actual function, but it prevents the fibrosis and atrophy that occurs, and we usually will see significant atrophy in the penile tissue within 4 to 8 months post prostatectomy. It's very important to start that early. And as Dr. Lederer showed, by combining the vacuum pump with the compression, or what we call a retention band, that will allow the user to actually maintain the erection. They achieve the erection with the suction, and then the band actually maintains the blood in the penis so that they can actually have intercourse. One of the caveats, I will say, most important one probably, is that restriction band cannot be left on for more than 30 minutes, because while it is holding the blood in the penis, it is preventing any new blood from getting in. So that blood becomes completely deoxified, and you have a risk of hypoxia and tissue damage. So you have to leave it on for 30 minutes at the most, take it off and leave it off for an hour, and then you can put it back on if you need to. Here are some of the pros and cons of vacuum pumps. Pros: it's quick and easy. It's fairly reliable. It's not a surgical process or medication that you have to take. It can be incorporated as foreplay in some cases, and some people will actually do this even if they don't have ED. It's really a one-time out-of-pocket process, so you're not having to pay monthly for medications or for surgery. And really, other than some bleeding disorders, there's not a whole lot of contraindications. Disadvantages: the instability at the base. So what this means: natural erectile function. When you get an erection, the corpus cavernosa, the chambers of the penis, extend within the body, which provides rigidity to the erection. With a retention band, the erection starts at the band, so you have a point of flexion, and that can be a little bit disconcerting and difficult to manipulate. There can be some color changes as that blood is kept in the penis, especially if it's kept too long. For some patients, they have a difficulty once they climax. The ability to ejaculate, the constriction of the band prevents the release of the ejaculate. Getting used to them for some patients is a little bit of a trial, and I always talk to patients about this when they first start using it to avoid a lot of pain and discomfort. Number one, it's a gradual process of getting used to having that erection again, especially if it's been a while. Number two, those restriction bands, they're basically a tourniquet. So you have to find the size band that is functional without getting to the point where it's going to be extremely painful. There can be some discoloration, the petechia of the tissue. And then secondly, it's a mechanical thing, and it's bulky. It is really hard to hide it. If you've ever seen Austin Powers, that's not my bag, man. You have to use lubricant with the pumps, with the rings, so that can be a little bit messy, but again, for a lot of folks, it's a great answer. Here you have an example of different size rings and a ring applicator. So the ring actually goes onto the end of the vacuum pump and then is discharged onto the penis. So makes that very easy for the patient and functional. So another option, this is more in the regenerative therapy side of things, shockwave therapy. Commonly we see a lot of information about Gainswave. So what is it? It's low intensity shockwave therapy. And these are sound waves that are delivered to the penile tissue. It's a little wand that gets kind of rubbed over the tissue of the penis. And this stimulates blood flow and can potentially help to break down plaque buildup in those blood vessels. If there has been tissue damage and it increases the blood flow to the area, it has the potential to accelerate or enhance the healing. And there is also the claims that it can actually remap blood vessels um, to generate more blood flow into the penis. Now, one of the things with this, it's not FDA approved, and um, a lot of the manufacturers have very interesting ways of talking about this, especially if their devices are used for anything other than ED, because there's obviously shockwave therapy for orthopedic use and for rehabilitation use, physical therapy, a lot of things. If they have a market outside of ED, chances are they won't even mention ED in their literature, because if they do, they are precluded from insurance because they can't make a ED claim if they're trying to bill insurance with them. Just an interesting side note. Um, who's a good candidate? So really, it's men with more moderate ED. Um, there's really not a lot of data that says, somebody who's been like through a radical prostatectomy is going to see that much of a change. Uh, just not studies haven't really been done, so it's hard to say. I've not seen a huge benefit for that population. Um, Again, so what patients are going to go towards this? Men who either can't take your PDE5s or are not responding to them may try this. One thing about this is it is fairly expensive, and it is not a one-time treatment. These guys are getting, sometimes a dozen, sometimes 2 dozen treatments with this, and it can take a long time and can cost a good bit. Risks with the shockwave: some discomfort, and you could get some irritation and a little blood leakage into the tissue, um, but really not too much. The at-home devices, I'm just going to tell you, they're advertised all over the place. You see this one, there's one called the Phoenix. They're just not efficient. The devices, the machines, the actual low intensity shockwave devices that are in clinics, they can be anywhere from $20 to $100,000, and there's huge differences in terms of the efficacy, in terms of the different equipment that's out there. These at-home devices just don't have enough punch, so to speak, to really do much of a trick. So they're more gimmicky, and I would definitely steer patients away. Here's another regenerative treatment: platelet-rich plasma, or PRP injections. So it goes by different names: Priapus shot, P shot, and this is a process of, you extract the patient's blood, and then through centrifugation you separate the platelet-rich plasma, and it's then injected back into the penis. Um, and it has a healing philosophy to it, that it's going to heal the tissue and help with restoration of function. Still very much considered experimental treatment, even though it's been around for a long time. There's a lot of evidence out there. Most of it, however, is not from solid clinical trials. Most of it is anecdotal. It Again, the P shot, the claims are tissue repair and improved cell response, uh, increasing blood flow to the penis. Um, Effective rate, so claims are up to 60% or more. However, there's really no statistical evidence showing that this is really all that functional. And the results of the shot are not immediate. So again, really hard to gauge when the outcomes are measured anywhere from 24 hours to 6 months after the treatment. And it's typically not a single treatment, so very, very common that patients will go back in and they'll do this 2 or 3 times several weeks apart. There can be some side effects with this, certainly bruising, bleeding, um, possibly infection. I have personally had patients come with kind of very geographic swelling around the area where the injections are done, as opposed to affecting the entire penile tissue the way it's supposed to. So there can be issues, and it's out there. It's used a lot, but not really sure that it would be considered a first line treatment. Another regenerative is stem cell therapy. Again, stem cell therapy is considered experimental. Um, the thought process is that stem cells can differentiate into a variety of different cells. So whether that be the smooth muscle, endothelial cell, or Schwann, or neuron cells. Therefore allowing the body to basically use them the way they need to for healing and repair of damaged tissue. There has been some promise with the results, and no real safety issues, but in terms of really putting numbers, significant quantifying success with this, it's difficult because uh, standardization of studies is difficult. Number one, there are different stem cells. They can be sourced from different parts of the body. Um, most of the studies are small in scale and don't have particularly strong protocols. So the results are, again, not going to say it's 100% anecdotal, but there's just not really great data. I mentioned about differences in terms of the types of stem cells. So umbilical cord derived, bone marrow derived, adipose derived, placental matrix derived, Wharton's jelly derived. Where are they coming from, and who are they coming from? Are they coming from the patient, or are they sourced elsewhere? Again, this is where you get into ethical issues of, what is the standard of measure? What is the promise of success? And this falls under one of those categories. They call it predatory health-related tourism, because a lot of patients go abroad for this type of treatment. There are promises of these miracle cures, whether it be for ED or cancer or what have you, from clinics outside of the country. Generally, they are offering lower cost procedural as far as the expenses are concerned. And really, a lot of it is still very unproven in terms of methodology and outcome. So again, this is really considered more of an experiment, and maybe this will be something. There's just a lack of a lot of good data. There's lack of standards in sourcing, um, in general, manufacturing therapeutic cellular products. So good thoughts for the future. In that same category of regenerative health, exosome therapy. So exosomes are extracellular vesicles of endosomal origin. And these are tiny particles, nanoparticles, um, and they carry biological information. They carry nucleic acids and proteins and lipids. And the thought process is that these tiny little particles are able to infiltrate cells and deliver these chemical messengers, which then convey the process of healing for physical or pathological self. The applications of exosomes go well beyond erectile dysfunction, so including cancer therapies and HIV. But again, experimental, a lot of promise to it. Just there's got to be a lot more work done on this. So, what is the thought process as far as the restoration of penile tissue? Um, it's projected that this can help to prevent the breakdown of the endothelium smooth muscle. Possibly, kind of like we were talking about with the low intensity shock wave, formation of new blood vessels. Um, More likely, the reversal of fibrosis in the scar tissue and then improving erectile function. In type 1 and type 2 diabetes, the exosomes isolated from the adipose-derived stem cells provide recovery of erectile function through increased intracavernosal pressure. And this, in turn, is elevating endothelium and smooth muscle content. So again, studies are there, and it does show promise. Based on how the exosomes are sourced, this is going to determine really what functionality is, and where they're going to work the best. So certain exosomes basically will be retained in tissue better than others, is what it comes down to. In terms of like surgical damage or after a prostatectomy where the nerves have been severed, actually they're doing studies, they're showing that in rat studies there are regenerative processes within 4 weeks of the exosome injections. So palpable improvements. Again, it holds promise. Bottom line, studies, clinical trials. It's a hard field to get good data in, so everything is preliminary at this point. From the surgical standpoint, penile implants. So for a lot of patients, and again, this is maybe the end stage for ED patients in a lot of cases. Either they've had a prostatectomy and they have nerve damage and they don't have sufficient blood flow, so medications don't work. Or they have used the different types of ED medications and they're tired of them. They don't want to do that any longer. Or they have reasons that they can't take those medications. So they have contraindications, whether it be to the oral medications or the injections. In some instances, these patients simply don't want to bother with medication and they prefer to have the spontaneous response that the implant imparts. This is really not a real complicated procedure, but it is a surgical procedure. So with all surgeries, there's risks. There is an incision that's made near the scrotum. And what happens is there are two inflatable cylinders that are placed within the corpus cavernosa of the penis. And the size of those cylinders is determined by patient anatomy. Then there is a bladder that is in the patient's abdomen. And then there is a pump that is down in the scrotum. So it's a mechanical pump that, when activated or when the patient squeezes it repeatedly, that pushes the fluid from the bladder into the implants and allows for the erection. Patients can use this as frequently as they care to. They can maintain the erection as long as they want to. There's some limitations in terms of the size of the implant. You can't put a larger implant in than the patient's anatomy will allow. There has to be room, otherwise you can have tearing of tissue. The other caveat with implants is these are mechanical. These are, devices that are produced. There are pieces and parts that will wear out. So it is not uncommon for patients certainly within 10 years, a lot of times they have to have them replaced. To prevent infection, these devices are coated with antibiotics, which is a huge improvement. There's less than 1% site of infection with these types of procedures. And in most cases, patients' insurance, Medicare, will cover this for them. So it can be a very viable option for a lot of patients. This actually is a illustration of what the implant looks like. You can see the pump mechanism in the scrotum. You can see the fluid bladder and then the actual inserts. So you pump that little pump up until you can't pump it anymore. It gets very firm and you won't be able to squeeze it. And that means that as much fluid has been pushed into the implants as possible. And then when it's time to get rid of the erection, you open that little valve on the pump and typically manually manipulate the penis to kind of squeeze that fluid back out. So in summary, there's certainly a lot of demand for remedies. We're constantly looking for new ED medications, and we're looking also at combinations of these non-prescription therapies, whether that be these different herbals or combining that with lifestyle changes. Certainly, we have some of these mechanical devices that can be very beneficial for patients. The supplements that have been around, the herbs that have been around, again, most of these have been around for a long time and have been used by society for generations, but always looking for new things. Becoming familiar with all of what's available can be extremely beneficial for your practice and for your patients, simply because a lot of patients are looking to avoid the pharmacological response. They don't want to go through pharmaceutics. They want to do something more natural. So, keep in mind that there's a lot that's out there. Also, keep in mind that there is a lot of garbage as far as the kind of available supplements that are advertised. I mean, there's pages and pages and pages of over-the-counter supplements, and some of this stuff is from magazines. Some of them are in your gas station. Some of them actually have active ingredients like PDE5s. Some of them are completely mislabeled. So it's very, very important to be an advocate for your patients so that they avoid the bad stuff. Because again, there's a lot of crap that's out there. And as always, the more we can do, the better we are and the harder we live. So keep learning and educating your patients. And thank you so much for your time.